Hello and welcome. You're watching a deep dive with me, Vineet Malhotra, and Pakistan's Health Minister Mustafa Kamal is having sleepless nights. The reason now is a $1.2 billion import bill staring at him. The reason is the halt of cost-effective vaccine supplies from India. The supply stopped after Operation Sindoor, and the minister said that Pakistan imports vaccines at an annual cost of about 40 million US dollars, out of which 49% of the cost is covered by international organizations that operate through Gavi. Gavi, or Global Alliance for Vaccines, was formed in 2000 to improve access to life-saving vaccines in low-income countries. Gavi brings together governments, UN agencies, vaccine manufacturers, and philanthropic organizations to fight preventable diseases like measles, polio, pneumonia, and other diseases. India maintains a deeply collaborative, evolving partnership with Gavi, the vaccine alliance, shifting from being a recipient of support to a key strategic partner and donor, with 60% of all Gavi procured vaccines manufactured in India. India transitioned to self-financing its own vaccine program in 2022. Some of the examples of India's contribution to Gavi can be imagined by some of the deals the Indian companies have signed. The Serum Institute of India entered an agreement with Gavi and UNICEF to supply 10 million doses of pneumococcal conjugate vaccine, which is the PCV, annually for a decade to Gavi-supported countries. As part of a 2025 deal to cut costs, Indian manufacturer Bharat Biotech is expected to take over production of malaria vaccines, offering them at reduced prices, with the goal to scale up to 100 million doses annually. The story is the exact opposite when it comes to Pakistan. Pakistan is highly dependent on the Global Alliance for Vaccines and Immunization, or Gavi, for funding and access to many life-saving vaccines. Gavi provides financial and technical support that allows Pakistan to immunize children against diseases like pneumonia, rotavirus, and measles. The alliance also helps strengthen cold chain systems, vaccination campaigns, and healthcare worker training across the country. Under Gavi's co-financing mechanism, Pakistan contributes a small portion of vaccine costs, while the bulk is funded by the alliance. This support is crucial because Pakistan's domestic budget cannot fully cover the cost of new vaccines. The current situation is not at all helping Pakistan's poverty-ridden people, and diseases are on the rise. In Pakistan, as per official figures, half of the population, around 47.6 million people, live under poverty. In 2025, Pakistan reported a measles epidemic. Over 131,000 cases were reported in Pakistan in just 3 years, with children under 5 most affected. That has worsened with over 17,000 cases reported in 2026, driven by low routine vaccine coverage. The surge, which primarily affects children under 5, is over 3 times higher than the WHO outbreak threshold. That has worsened with over 17,000 cases reported in 2026 alone, driven by low routine vaccination coverage. The surge, which primarily affects children under 5, is over 3 times higher than the threshold, as already said. Pakistan also continues to battle polio transmission, remaining one of the only 2 countries in the world where wild polio virus still circulates due to gaps in immunization coverage and access challenges. After a period of relatively low cases, polio counts climbed again in recent years, with dozens of wild poliovirus type 1 cases reported across multiple provinces as routine vaccination missed many children. These outbreaks have a direct impact on child mortality in Pakistan. Measles, pneumonia, and polio together contribute to hundreds of thousands of deaths among children under 5 every year, with pneumonia alone accounting for around 91,000 child deaths annually and diarrhea adding another 53,000 deaths. Gaps in routine immunization leave millions of children vulnerable to preventable diseases, making Pakistan one of the highest contributors to global child mortality from vaccine preventable illnesses. And the dependence on India for vaccine is high. In 2023, Pakistan imported vaccines worth 303 crores from the world, with India emerging as the largest supplier, providing vaccines worth about 139 crores. This accounts for nearly half of Pakistan's total vaccine imports, highlighting the country's heavy dependence on India for essential immunization supplies. Despite geopolitical tensions, Indian pharmaceutical companies remained a critical source of affordable vaccines for Pakistan. Supply supplying life-saving doses that are vital for the country's routine immunization programs and epidemic response. For Pakistan to arrange 1.2 billion rupees annually just for vaccine imports is going to be difficult. Why the country is knocking Saudis' doors again? Well, its full tranche of loan granted by the IMF was $1.2 billion. Pakistan's external reserves are at around just $20 billion, depleting constantly. Its external debt is around $130 billion, with most money being owed to World Bank, the ADB, IMF, followed by China and Saudi Arabia. So the big question is, who is to blame? Well, for a country that is reeling under poverty crisis, it is being led by people like Asim Munir and Shahbaz Sharif, who rather than addressing the problem were in Pakistan-occupied Kashmir to make political insidious statements against India. This is not an administration worried about the well-being and future of its people, but would rather spend all its money on saving its terror infrastructure and upgrading their weapons to fight a proxy war with India. It's time Pakistan's people speak up and ask serious questions from Asim Munir. Is their life being held hostage so that he can fulfill his dictatorial ambitions? Is the big question. We'll talk about this with our guest. Joining us on the show is Dr. PSV Rao, consultant surgeon, Manipal Hospital, Bangalore. Dr. Rao, appreciate you being here with us. What is the gravity of the kind of exports that India was doing via Gavi to countries like Pakistan as well as a number of countries in the global south? While they don't have a geopolitical bone to pick with India, Pakistan does, and it is suffering.
Good evening, Vineet and all your viewers. This is a real self-goal that Pakistan government is scoring. Pakistan government has basically been run by the army. The funds are all diverted to the army and its businesses, and health and education are being ignored. And this is the end result of all governments and all nations where health is ignored or it is not funded adequately. They are totally dependent on imported vaccines. They don't manufacture any vaccine. India is the world's biggest manufacturer of vaccines. We supply free or subsidized vaccine to a lot of nations. We did that in COVID. And if you remember, COVID was finally stopped by vaccination. And if, like you have already mentioned, it is sad that because of Pakistan and Afghanistan not eradicating polio with vaccination, that polio has not been eradicated. Otherwise, by now, polio would have been eradicated from the world, just like smallpox was eradicated. The problem is misinformation about vaccines being causing impotence. This is what was, and infertility. This was a misinformation that went on, and health workers who went to vaccinate were shot dead. And how do you expect the population to be vaccinated if this is what goes on? And then you don't have enough vaccines, and you are dependent on someone giving it to you in dole. And it is not India directly giving you free vaccine. We are subsidizing it in our sales to Gavi, and then Gavi pays for the rest of it so that Pakistan can give free vaccine. But even that free vaccine, if the health workers are going to be shot and there is going to be so much of misinformation, no wonder you are going to have a very high mortality rate. Vaccination has brought down, there are two things which have brought down infant mortality world over. One is vaccination, the other is sanitation. You mentioned that diarrheal deaths are very high in Pakistan. It is because of lack of sanitation. So these two things have to be addressed. And the polio problem is that you will have a whole lot of children who will be disabled because of polio. Their limbs will be affected and they will grow up disabled. And I don't think the administration is the least concerned. I mean, the administration seems to be least concerned about what goes on. And the danger is that this polio is, there is always this danger of polio from Pakistan, Afghanistan spreading to other parts of the nation. As long as if it is eradicated, like smallpox is eradicated, we don't have to fear it. But polio, we have to continue vaccinating the rest of the world, just because these two nations don't have not eradicated polio with the vaccine that is available. And you mentioned about measles. Yes, now you see what happened with vaccination resistance in US. They have started having lots of measles deaths. This vaccination is what has saved us from a lot of infectious diseases. Government should totally focus on it and ensure infant mortality comes down. It is only when infant mortality comes down that the fertility, the birth rate will come down, and then only the economy can improve. If you are going to keep producing kids, and most of those kids are going to die or be unhealthy, how is your economy going to improve? I think the priorities of Pakistan government are totally off the mark. Yes, Vineet, anything else?
Fair enough, sir. Appreciate you joining us. Thank you for those insights and that valuable perspective that you gave. Obviously, Pakistan should know better when it comes to the health of its own people. We take a short break now. We'll be back.